Hello and welcome. I'm Shalene from Cornerstone, and today I have with me Hannah Whittington, the Deputy Head of Safeguarding at the London Ambulance Service, here to talk to us about how they've implemented VR into their training. Thank you, Hannah, for joining us. So what I just wanted to talk to you was about VR. So can you tell us why VR? Why did you get VR in your service?
It was for a lot of reasons, really. We were kind of looking through our training and looking at ways that we could be more innovative and look at ways that we could use different mediums to help support our training, and especially with our ambulance crews, they very much learn visually and by doing. So it felt like a good use of this equipment to be able to do that. But we also had sort of feedback and good experience from another trust who were using it, who kind of advised how they'd been using this piece of equipment and how much it had helped support their staff as well. But for us, as I say, it was essentially to try and improve our training and you know, use other mediums really to help support our crews and how they learn as well.
Yeah. So in terms of how was the VR kind of used? So you've spoken about you got it for training. So how did you use it in training? What sort of training did you use it in?
So for us, what we did was, so our team spent a long time kind of getting familiar with the equipment, getting familiar with the resources on the VR. And what we decided as kind of our team was we picked a series of those videos with which to create a bespoke sort of CPD session. We called it Have You Seen Me? So we had Have You Seen Joe? Have You Seen Aisha? And really followed the journey of that child through those videos and created space within that CPD for people to immerse themselves in that story, but equally then have time to discuss and really debrief and talk about their own practice and how they might change and improve their approach really to children who might be in a similar situation, and really trying to focus on that trauma-informed approach to practice, which is what we're really trying to promote within the service at the moment.
Yeah, and that's fantastic. And I guess just off the back of that, you know, as paramedics, there's so much that they've got to kind of be thinking about in terms of the medical side, and then obviously from a kind of safeguarding point of view. So how is it in terms of the training, the CPD around that kind of safeguarding side? And, you know, Have You Seen Me, which is a great kind of title, thinking about those children that they may kind of see regularly or maybe one off. How is that really promoted within the service, and how VR is kind of used as part of that?
So what we're really trying to do is obviously it's a medical setting, and they are trained to be clinical assessors really when they're on scene. So what it's helped for us really is, and what our approach is trying to do, is really promote that patients aren't one-dimensional, and actually we need to be looking holistically at that patient and looking at the social impact, because often you know, I think ambulance trusts are recognising now that people don't necessarily always call for a medical reason. There is often a social or emotional reason actually behind a lot of their symptoms. You know, not dismissing the medical aspect of it equally, but, you know, recognising kind of that social impact as well. And I think what VR has helped people to do is to see that patient, and especially with the children in these scenarios, as more three-dimensional individuals. They're not a series of symptoms that they kind of need to go A, B, C, and this is kind of the treatment that we give. It's actually seeing all of the multifaceted aspects we are as human beings, and how that might be actually impacting on how they might be presenting to them. And actually, if someone maybe is being more combative or I hate to use the word difficult, but kind of coming across as quite complex in how they can engage with them, helping to support them to recognise, actually, I need to take a step back and think, how do I approach this differently? What might be the experience of this child, and what questions do I need to ask? What do I need to think about for this person that actually might help me in meeting the medical need of this patient, as well as thinking, actually, what furthermore do I need to do to help support them aside from that medical intervention?
Okay, great. So the other thing, just kind of picking up on that, is I know one of the things that was kind of changing within your trust was around referrals and thinking about how this CPD can kind of help with the referral process. Can you just talk to us a little bit about that?
So one of the things that we're kind of doing a lot at the moment in terms of developing our referrals, but one of the things we've always wanted to do really was improve the quality and the information that's in them, and to really ensure that the voice of the child is within those referrals. So with this VR training, what it's helped to do and help support staff with is to consider the voice of the child and to think about the questions that they're actually asking them, to help ensure that on our referrals that actually it's really reflective of the experience that that child is having, and actually what they feel their needs are, and how that can be voiced to social care or other services that might need to know that, and to help support them further from what we can do in that moment with them.
Yeah. Great. So in terms of some of the feedback, what's been some of the feedback from the staff members who have attended the CPD? Because I know obviously they've got to do a certain amount of hours, and obviously it can be quite tricky doing training alongside their kind of shift patterns. So what has that feedback kind of looked like?
I think one of the things that we've noticed is it's around just getting those people available and ensuring that they can have that time to do that training. There's been a lot of interest in it, though, I think because of kind of the new experience of it as well. It's not something that they've done before. A lot of people were interested in that experience of using the VR headsets. But I think for a lot of people, when they actually were there and in the training, they were really impressed about how immersive it was, and how actually it really supported their ability to be reflective of those children's experience, but equally of their own practice. And it helped actually a lot of discussion, reflection around previous cases that they might have had, and actually how they could have approached that slightly differently, and things that they might have been able to do slightly differently as well. So it really supported that process for them, really.
Yeah. And kind of prior to VR, was there much of that kind of reflective process?
So we do offer supervision, but it's more of in terms of staff availability, it's an ad hoc basis. So it would be around staff requesting that in order to reflect. Or if we felt there was some learning, then we would encourage that a little bit more. And obviously we have our 3-yearly level 3 training for our staff, where we try and do case scenarios, case studies, where we do reflection. But no, this opportunity to really sit with a group and offer that opportunity for reflection isn't as readily available as this kind of made that possible. Yeah.
Great. And can you just talk to us, because I know, kind of the title, Have You Seen Me? I know you guys obviously delivered a conference around that as well. So can you just talk a bit about that? And I know that VR was involved in that as well.
So for us, the Have You Seen Me kind of topic kind of came about just around thinking about those marginalised groups, really, or those people within our society that we may just not see, who fall under the radar, who we think might be managing and getting on, but actually do we need to use our professional curiosity or to dig a little bit deeper to understand actually what's going on for those individuals. So one of those was around, obviously, looked after children, around children who may be experiencing CSE, but there were sort of other topics as well, and especially around violence against women and girls. That was a big part of that conference as well. But really trying to look at those areas of practice that we may not focus on, or be as obvious in our own practice when we're out and about, especially for ambulance staff who see a multitude of different people, especially in London, different scenarios, ensuring that they're actually seeing everyone and thinking about who they are as an individual in that instance, and ensuring that we're meeting their need as best as possible.
Yeah. And would you agree that the kind of the VR, having the VR there as well, also kind of complemented that because of the different kind of themes that the films kind of run through?
Definitely.
In terms of those subject areas.
It was a really positive feedback around the conference feedback we had anyway, around having the VR there. People felt it really complemented kind of the theme of the day, but also gave them that chance to reflect and kind of learn while they were there as well, in a different way to having a speaker, which is the traditional conference way. So it was nice to have something that was slightly different for people.
And just kind of taking back just a step where you spoke about that reflection, and because one of the things that we talk about the VR, and that I would say is that it's very difficult to kind of come out of the VR and not to reflect. And it sounds like that's what's been happening, kind of using the VR with the ambulance service, that actually that's been quite immediate, whereas other kind of pathways to that maybe kind of a few steps to get to that kind of reflective space, whereas this is that real immediate, tangible, let's kind of just sit and open up and think about this a bit differently.
Yeah, definitely. And I think because of the medium that VR is, I think when people are immersed in that experience of being in the shoes of that child, you can't help but be reflective afterwards. The experience of that and the emotions that creates for those people and those individuals using the VR. I think it just naturally flowed to enable that conversation and for them to feel that they wanted to reflect as well. I think it enabled them and opened that kind of door for them, I think, a little bit.
Great. Okay, thank you, Hannah. That's been really helpful. Is there anything else that you want to share?
No, just that as a service, it's, we've really loved using it, and it's been really positive for us.
Fantastic. Oh, thank you.